Hello and welcome to the Friday, July 17th edition of the Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith and I'm here with Incident Manager Dr. Stuart Kennedy. Dr. Kennedy, I'm off next week, just so you know. I'm off.
Wow, and that's why you're trying to blind me today with the orange apparel.
Orange, you glad I'm off next week?
Boy, it's hard. It's hard.
So I want to ask you for a bit of an update on Care Partners. Now, people are waiting for an update. We still have some final details to work out, and those will be completed very soon. We'll be issuing more information, but can you preview some details? Anything you can share today?
Yes, Tracie. Out of all the decisions we made here with our incident management team, these have not only been the most difficult, they've been the most controversial. And certainly it doesn't follow our philosophy of family-centered care. And we realize that. But this was a different time. This is a different crisis that we really need to protect both the staff and the patients, as I said multiple times. But we've got a lot of concerns out there as the province opens up to phase 3. Why aren't we sort of opening up to Care Partners? And as I said multiple times, I said this is a concern because of our isolation at Thunder Regional Hospital. And if anything, COVID-19 comes to this hospital and we have to start shutting things down again, we don't have any secondary options. So yes, we are cautious. I don't think we're overcautious. I think we're just being responsible. But I know it's a concern. And so, yes, we revisited it once again. I think we've revisited this policy probably 10 times over the past several months, and rightly so, because it means a lot to patients and their family. So we're working up the finer details. For the next sort of several days, we're still going to maintain the essential Care Partners, but Care Partners will be introduced into this organization sometime next week, and the details are to follow. But what I can say, as far as Care Partners go, the hours of visitation will still be quite restrictive, probably 3 to 4 hours just in the late afternoon, early evening, and you'll only be limited to one, and without changing that Care Partner. So again, those are the early details, but I'm hoping to report back after we work out the logistics and the details that sometime next week we'll be opening up to Care Partners.
Well, good. We look forward to sharing those specifics. A lot of people are waiting for that.
Did I say too much? Did I give you too much away?
No, I think that's okay.
Okay,
I think
good.
you were
Okay.
fine.
Okay.
Now, when people come into the hospital, of course, they are still screened for COVID-19. And people will notice that one of the questions that they're asked when they come in is around travel outside of Northwestern Ontario. Why is that still a question at screening?
Hey, great question. I mean, this just enhances our scrutiny to make sure we are not allowing individuals who are coming from a higher risk area. Because right now, phase 3 or stage 3 has not been opened up to all sort of locations in Ontario, just the vast majority. But there's still some hot zones around, and certainly there's certainly some hot zones throughout Canada that we want to be aware of. It doesn't mean you cannot come into the hospital when you screened positive for travel outside of Northwestern Ontario. There's just a more thorough history taken to see what particular area of the country or the province you're coming from. And then if it's a high-risk zone, then we have to have another discussion about how urgent this test is, or would we actually have a sort of a test done prior to coming to the hospital. Again, just taking all the precautions that are required to protect this environment. And, we don't know, with stage 3 opening up, gatherings 50 or more, certainly maybe, was it 100 or 50? 50 I can't remember. It changes so quickly.
100 outdoors, 50 indoors.
Okay, so I was both right on both times. But we just have to make sure with the opening up the businesses, and we've seen what's happened in other areas of the province, like nail salons, some restaurants, some bars, that there has been increased COVID-19. So we have to be prepared for that, and that's why we're going to continue to ask that question for the time being.
So if someone has been traveling outside of Northwestern Ontario, and even if they have been in an area where COVID-19 is still more prevalent, if they have to wear a mask, masks are mandatory now, why would it matter?
Why would it matter? Because the mask protects you from spreading the infection to somebody else. But again, mask is only one defense for all of this. Symptoms may not be prevalent initially, and then then it would actually, from my perspective, and from infectious disease perspective, we'd actually then consider if they have to wear their full PPE, not just cloth masks. So again, it's a risk assessment that has to be sort of done at the initial visit. And then if the screeners don't have the answer for that risk assessment, they'll be screened by either our occupational health department or medical affairs department, and they'll make the determination whether any type of testing is required or enhanced PPE. So again, masks are just one, cloth masks are just one sort of defense protecting against any type of spread of COVID-19. Wash your hands, wash your hands, wash your hands, sneeze into your sleeve, and don't come here if you have any symptoms.
Well, and there are also procedures where a patient can't be wearing a mask, so that would come into play as well.
Absolutely, there's certainly any type of aerosol generating procedure, any type of procedure on the nose or the face. They cannot wear a mask because the site has to be exposed. So again, that would put our healthcare workers at risk and other individuals around them at risk if we do not know their status.
So it makes sense that we would still need to know that information.
Yes.
Now, our hospital has had a restriction on staff in terms of their ability to work at more than one location. That obviously was in place to help reduce the spread of infection or the risk of infection, and those restrictions have just been lifted. Why have those been lifted, and what does that mean for us?
Again, this is quite a hotly debated item at IMS, and it makes sense to open up other employment opportunities. Right now, we're opening up phase 3, stage 3. People are now going out to restaurants. People are now going out to bars. People are now sort of gatherings of 50 to 100. So there will be more exposure. So it didn't make any more sense to limit employment because we wanted to make sure we did not bring any COVID-19 here. Right now, we only have one active case in the community, I believe. So the prevalence is not a lot at this point in time. And areas are struggling. I mean, we need individuals to get back to work in restaurants and bars. We need individuals to get back to work here at the Regional Hospital. So it's necessary to actually let individuals earn a living. It also is important that we create employment opportunities and also don't be short-staffed at the hospital or other areas. So we have to be a cooperative partner with everyone, and I think the risk is very minimal, so it's just a good HR practice to do.
The timing was right for that, and to your point, we have many part-time or casual employees who work elsewhere who decided to work at their other locations and not work at the hospital for the last little while, and that could result in us being short-staffed. So good to have them back during vacation time.
Yes, absolutely.
Excellent. Now, as you know, the health unit is making masks mandatory in indoor public spaces, public transit, taxis. That's going to come into effect next Friday for the entire district. What is your response to that?
Great news. I've gone out the occasional time to different stores, and I would wear a mask because it's the right thing to do. But the vast majority are not wearing masks. And when you're only the one or two wearing masks, you feel sometimes a bit foolish, although it's the right thing to do.
Makes you the smartest one in the room sometimes.
Sometimes. People would debate that, mind you. But certainly, I think once it becomes the norm, there's a more comfort level that everybody's wearing a mask together. And again, because phase 3 is opening up, it just protects each of us from spreading any COVID-19 as the businesses open up, as the economy opens up. We can't afford to have what happened in the United States, and you saw what happened in the United States with the increased gatherings, the no wearing a mask. Masks are a proven sort of technique to actually prevent transmission of COVID-19. Mask and physical distancing. So from our perspective, from a public health perspective, from the hospital perspective, from healthcare providers, there's no debate. Masks should be worn in public places when you cannot keep that 2-meter distance, and that's why we made it mandatory at the hospital. And I'm thankful the health unit has made that mandatory, and the city's made that mandatory. I think it's the right thing to do, and that will have to be revisited, many times again. But it's the right thing to do, and I really encourage everybody to put on their masks, be respectful of each other.
It is the kind and respectful thing to do. So thank you to those who have been diligent here. So how is the mandatory mask implementation going at our hospital?
Yeah, outstanding. I just like to thank all the public because the vast majority are bringing their own masks. We certainly don't have a lot of masks to give out, but we have given them out in appropriate, sort of situations. But it's been not a lot of debate when I last checked with the screeners at the front door. So I encourage everybody to still come prepared, wear their mask. It's going well at this point in time. I know there's human rights, people who feel they should not be forced to do anything, but you're protecting your loved ones, you're protecting our healthcare workers, you're preventing COVID-19 spread. It's the responsible thing to do at this point in time.
Absolutely. So, Dr. Kennedy, just a final note, we're in stage 3 now. Are you planning any gatherings of 100 people or anything change in your life?
It's been always difficult for me to keep my sort of gatherings less than 100. But I've been pretty curtailed over the past 4 or 5 months. So nothing planned for over 100. But I do think when all this is over, we need one hell of a party.
Yeah, I think so too. and this phase 3, stage 3, is good for families. It's nice to see people be able to connect again, as long as they're doing it responsibly with their physical distancing or their masks.
Yes.
Excellent. Enjoy the beginning of stage 3. We'll see you again soon. Stay safe.
Stay safe.